I'm Grant Garcia, one of the sports and shoulder surgeons here, as well as cartilage surgeon. Today you're going to see their testimonial. This is a young girl who had a pretty challenging issue. She had a number of dislocations of her kneecap, but on the last dislocation she broke off a pretty large piece, about this big, and that was chronic, and so it was actually stuck behind her knee. So the first surgery, we went in there, we actually had to remove the piece out of the back of her knee arthroscopically, also did a MACI procedure, or MACI biopsy. And then the second surgery, she had to have a bigger procedure because she had instability of her knee, but she also had a pretty large cartilage defect, and we didn't want her to wear down the rest of her cartilage. So we performed a MACI, an MPFL reconstruction, and then we had to also do a tibial tubercle osteotomy, which is a pretty large combination, but we've seen good success in the right patients. So hopefully you enjoy your testimonial, and she did really well, and thank you.
So I had gone through years of my knee being dislocated through tennis and other sporting activities. It got to the point where it was just super painful, and I really had a very unstable, painful knee. So I reached out to a doctor to figure out what was going on. I had tried physical therapy, and I was eventually referred to Dr. Garcia, who one of the doctors that referred me said he specialized in the MACI, and I might be a really good candidate for because of my knee dislocation. I mean, I couldn't really pivot, I couldn't lunge, I couldn't squat. Really bending my knee hurt. My knee would hurt just kind of at all times. It was very grindy. Come to find out, I actually, my last dislocation that I had broken off a piece of my cartilage, and it had like floated behind my knee, and it was just a mess in there. So my first surgery was, Dr. Garcia went in and he got a biopsy of my cartilage. He also cleaned out all of the mess that had happened through my dislocations, and that was a very, very easy recovery. So my second surgery was the TTO, the MPFL replacement, and the MACI was put into my body, and it was a fairly big surgery. I was really worried about the recovery. It was supposed to be a couple months. My fiance actually had the exact same surgery about 10 years earlier, and through the whole process we were amazed. Like, he kept saying, I cannot believe like the stage you're at right now. And I think that's really because of the way that Dr. Garcia did his aftercare. It's not a, you wait for 3 months and walk. You push yourself, you train your knee, you train your muscles in order to recover. And so you're walking at about 6 weeks. I remember coming in for my 6-week appointment, and I was walking like a normal person. Like, there was obviously some pain. I was still recovering. I was still freshly out of surgery, but I could absolutely walk without crutches. It was awesome. Surgery really exceeded my expectations. The recovery was very quick. I had almost no pain. To this day, I have no pain, and I'm full mobility. I am a skier, I'm a biker, I do gym classes, I'm able to do full mobility, zero pain. I'm back to 150%, and it was a very, very quick recovery.